experts from Brown and Emory universities broke down the future of the pandemic into 4 scenarios, ranging from totally gone to out of control.
This is In the Loop. I'm Christian Bryant. The Food and Drug Administration granted full approval to the Pfizer vaccine today for everyone 16 and up. Moderna's vaccine will likely be the next one to be fully approved, which means conversations around vaccine mandates, booster shots, and COVID variants will be a part of everyday life for the rest of the year. Meanwhile, masks have essentially become a part of our everyday fits. It's enough to make you long for earlier, simpler times, back around this time.
Adam Davies has now taken to doing puzzles and taking longer walks with his pup June.
More than 30 seniors came together for a social distancing block party.
Celebrate, even though we're far away, that we're all in this together. Finding the good.
Remember back in early 2020 when we all stocked up on groceries to get us through 2 weeks with minimal contact with the outside world? Yeah, some of y'all were low-key kind of excited to have to work from home for a couple of weeks, weren't you? And we were still asking questions like, how much longer could this 2-week quarantine go on? Oh, how little we knew. These days, the question is less, when will this pandemic end, and more like, what does it even mean for a pandemic to end? Now we know that's a shifting target because the virus and the science around it have always been shifting. Since scientists first learned about the virus, there's been a race to get ahead of it. And frankly, we're still trailing behind, struggling to get a grip on the virus. The vaccines gave us serious firepower in helping us hit back against the virus and lower the strain on healthcare centers. So when vaccinations in the US began, it gave many of us the opportunity to get excited for a normal summer. But the fight against COVID is a marathon, not a sprint, and the Delta variant has really taken off. It's almost as if scientists and health experts warned us about this.
One of the ways that you prevent the further evolution of virus to become mutational, the way you do that is to suppress the replication of the virus.
Although we are seeing progress in terms of decreased cases, hospitalizations, and deaths, variants are a wild card that could reverse this progress we have made and could set us back.
And while we can't predict the threats of the next variant, the science was pretty spot on about the dangers of giving the virus more chances to spread.
The heart-wrenching scenes echo daily across Brazil. COVID is claiming nearly 3,000 lives every day now.
The COVID crisis in India is worsening. New cases there are topping 300,000 every day now for a week. The healthcare system is on the brink of collapse with shortages of vital supplies.
Right now, the Delta and Lambda variants are causing a surge in cases around the world. A booster shot has already been approved for emergency use for Americans 8 months after getting their second dose of the Pfizer or Moderna vaccines, and it will likely be a similar case for Johnson & Johnson recipients. Turns out that vaccine isn't exactly a one and done. Right now, just over half the US population is fully vaccinated. We're continuing to look back on the pandemic, and what better time to bring in our health and science reporter, Newsy's Lindsay Thies. Lindsay, I kind of wanted to give some pandemic related topics a sort of then and now treatment. Is that all right with you?
Absolutely. We're so much better off now than where we were in the beginning, so happy to look back.
COVID living on surfaces is our first topic. I know that I own so many canisters of wipes. We have wiped things down incessantly. What is it we thought then about COVID living on surfaces, and what is it that we know now? How has the science changed?
The science really hasn't changed in terms of how we've come about to find these answers. It's just we've learned a lot more about this virus. So when you're talking about, wiping down those groceries or your takeout, for example, which, by the way, my sister still does it. So if it makes you a little less anxious or stressed, by all means, go for it. But in terms of what the science has continued to show throughout the past year and a half is that risk is really low. And the reason why we know that now is because when we think back to February, March 2020, there was so much we didn't know. The initial studies that were coming out were really these sterile lab clinical type studies.
If we can move on to the second topic, the contagiousness of the COVID-19 virus. We know that COVID can spread through droplets, which is why masks and social distancing is so important. What is it we thought then, and what do we know about the contagiousness of COVID-19 now?
Yeah, well, that's one of the things that has probably, as this virus has changed, gotten worse, quite frankly. So, and every virus in nature is going to continue to mutate and change because really, at the end of the day, all a virus wants to do is continue to copy itself as much as possible. So when you're talking about how contagiousness works, there's something called an R0 number that scientists use to calculate how infectious a virus is. And when we look back again, that February-March COVID strain of the SARS-CoV-2 virus, that R0 number was actually, Christian, closer to 2 or 3. And now, as this virus has continued to evolve, and you look at the Delta variant, that R0 is closer to the number 6, meaning that one infected person gets 6 people on average sick, and then those 6 people get 6 other individuals each sick, which is why you're seeing this virus at this stage in the game.
The last topic I wanted to get into is, is there an end in sight?
Yeah, what does that finish line look like, right? Well, full disclosure, I wish I could say I was a fortune teller or that scientists that I spoke to had a crystal ball, Christian. We don't. I think if that was the case, that would be the biggest breaking news, right? But we do know.
We would have to change the entire show then.
But I think what we do know at this stage in the game, after a year and 8, almost 9 months of this virus, and we've seen these different waves, especially in the United States, scientists have now been able to kind of map out a spectrum, if you will, of what some of those possible scenarios might look like.
It's a question many of us have. How will this COVID pandemic end, or will it? Experts from Brown and Emory universities broke down the future of the pandemic into 4 scenarios ranging from totally gone to out of control. We spoke with one of the authors and asked public health and vaccine experts to weigh in too.
How did we come up with this? I think we are, part of it is aspiration of where we'd like to go, and part of it is a reflection of what we've been seeing in this past year and a half.
At one of the end of the scenarios, eradication. Simply put, no more COVID virus across the globe, and the disease following it also down to 0 cases.
Eradication means there's really no need to control it because it's done.
There's only one example from the past century of an eradicated infectious virus, and that's smallpox. The last U.S. outbreak was in 1949. Could that happen one day with COVID? While scientists don't have a crystal ball, eradication is wishful thinking at this point.
It's not as likely just because it seems to be mutating at a rapid rate. It's it has different ways in which it can mutate. So I don't think it's going to be eradicated.
Moving along, elimination. In this, the virus isn't gone from the face of the earth, but is only spreading in specific regions, nations, and continents.
Elimination can mean, well, there might be less need to control it either in a certain time or place, but we still need to be aware that it's there.
We've seen this before. For example, the Ebola virus. We've seen this at times in recent months with COVID even, in Israel, New Zealand, even parts of the US, experts say. But now, the Delta variant is making this especially hard.
We voluntarily gave up the ability to eliminate or control this by our refusal to wear masks to get vaccines.
Perhaps the most likely scenario at this point, cohabitation. We figure out a way to live with the virus, with the focus on preventative vaccines to slow spread and widely available approved drug treatments to minimize death in severe cases.
It's there, and we're doing something that allows us to live our lives, and in a controlled way, but it is there. That infection is still there.
We have examples of cohabitation, like mono or the flu. For most patients, if you have symptoms, it's fairly easy to get a test to confirm you're sick, and vaccine protection or medication to keep most cases from being life-threatening or requiring a hospital stay.
It would be great to have a vaccine that would prevent transmission. That may be something that happens the next year or 2. It's always a moving object. We're continuing to, collect data and figure out where we are, but we shouldn't always think that it's going to get worse. It doesn't have to.
Lastly, on the other end of the spectrum, conflagration. Effectively, what researchers call a state of war between us and the virus. It would mean likely a variant worse than Delta. We haven't seen an example of it in the US, but Delta's spread in India gives us an idea of that scenario.
The lack of ability of someone to go to the hospital and get simple care, including oxygen, and not talking about ICU level of care, intensive care level of care and high level of medical care, but basics, and die from it.
Some of us are concerned that we may see the emergence of variants that might completely, or at least in large part, escape immunity due to prior infection or vaccination, in which case we start all this over again.
Now, the science will continue to change and will rely on the virus, which will change and continue to mutate as all viruses do. But the most important thing that impacts the likelihood of any scenario, all of us.
We generally, historically, had a lot more faith in our healthcare and public health institutions than we do right now. And I think we're going to need to rebuild that.
For Newsy, I'm Lindsay Thies.
All right, we're going to take a quick break, but we ain't done with COVID just yet. When we're back, we're talking masks and class.